Hello, I'm Tony DeMaria, the editor of JACC, and we've got some really neat papers that are about to come to you in JACC. So it's been known for some time that patients who suffer out-of-hospital cardiac arrest have a better outcome if they receive percutaneous coronary intervention or therapeutic hypothermia. However, the data we've had available has been short-term, 30 days to 1 year. A new study in press in JACC provides some evidence that percutaneous intervention and therapeutic hypothermia can have up to a 5-year benefit in those patients who survive to be discharged from the hospital. And the study includes some 1,000 patients with out-of-hospital cardiac arrest, 38% of whom received PCI and 25% of whom received hypothermia. In looking at the results in 5-year survival, 78% of those patients who received PCI survived, whereas only 54% of those who did not. In terms of therapeutic hypothermia, there was a survival rate of 77% as opposed to 60% who did not receive this intervention. Now, obviously, this was a retrospective study, and the first question that comes up is what variables were involved in deciding that some patients would receive PCI or therapeutic hypothermia and other patients would not. And there was a significant attempt to control potential confounding variables that may have been operative, and even with that attempt, PCI and therapeutic hypothermia continued to be a benefit in terms of long-term survival. So additional evidence that we should be more aggressive in applying these interventions in the patients with out-of-hospital cardiac arrest. The so-called RAP study, that's the Radial Artery Patency study, made a fairly big splash several years ago when they reported that in this randomized trial that radial artery patency was superior to saphenous vein patency for a 1-year interval in patients who were receiving an internal mammary graft to the LAD and in whom the radial artery or saphenous vein artery were used to target either the RCA or the circumflex. A paper in press in JACC now presents the 5-year results of this particular trial. And again, the protocol was relatively straightforward. Each of these patients received an internal mammary graft to the left anterior descending coronary artery. And then a radial artery graft or saphenous vein graft was assigned to either the RCA or the circumflex in a random nature, so that every patient received both grafts going to either the RCA or the circumflex, and the number of grafts to each of those vessels was approximately equal. So an interesting study, and the question is, at the end of 5 years, was there indeed a benefit? And when one looked at graft occlusion, then in fact 13% of patients who received radial artery grafts were occluded, whereas 20% of patients who received saphenous vein bypass grafts were occluded. So data that deal with graft patency, but not necessarily clinical outcomes. The anticipation would be, however, that enhanced graft patency would lead to a reduction in major adverse cardiac events. So I think some very powerful data that in patients with triple vessel disease undergoing coronary artery bypass graft surgery, that the radial artery graft really should be strongly considered in preference to saphenous vein bypass graft whenever possible. This is Tony DeMaria for another episode of Inside JACC. Thanks very much for watching.